Good afternoon, everyone. Thank you for joining me at another episode of Tuesday Tips. I am your host, Sharon Johnson from Train 51 Healthcare Consulting. First, I want to apologize. I had a faux pas about my two topics today and last week's Tuesday's Tips. We were to discuss today's topic, which is mastering patient throughput, key strategies for physician practice efficiency. Rather, we talked about budgeting, which is still a good topic to talk about in terms of practice efficiency and practice management. So I hope that topic was very helpful to you. So let's go right and dive into our topic for today. As I said, it is mastering patient throughput, key strategies for physician practice efficiency. Our discussion today will explore four topics, key strategies that we're going to talk about: streamlining administrative processes, optimizing staff allocation, implementing lean methodologies, and lastly, leveraging technology and telehealth. As I've mentioned before, your practice is going to be varying in size, scope, staffing resources, digital tools, and specialty. So when we're talking about our Tuesday tips, I would like you to consider that if any of these tips is applicable or can be implemented in your practice, I think it's something to consider. And those are the areas that you might want to review or overview, and also your workflow. What does that look like in current state, and what could it be in future state? So things to think about before endeavoring into any implementation or changes. Having said that, let's start diving into the topics that we talked about. So, streamlining administrative processes. So, one of the most significant bottlenecks in patient flow occurs during administrative procedures. So, by harnessing the power of technology, physician practices can dramatically improve these processes. The adoption of electronic health records, providing instant access to patient histories, test results, and treatment plans. If you have an EHR that is integrated with another EHR, or you have an access to those items, then that would be helpful in reducing the time for physicians spending retrieving information. It will also accelerate care delivery, instilling a sense of confidence and efficiency in the staff, and ultimately enhancing your patient care experience. We also have automated scheduling systems and online patient registration to further streamline the patient journey. So if you have these systems inactivated, this would also be a good streamlined tool to think about. These tools allow patients to book appointments, fill out forms, provide necessary information before entering the facility. Another tool is to have a pre-visit preparation. For example, it could be at your front desk and also in your clinic area. Chart preparation. What are some of the follow-ups that patient requires? Are there any testing that the physician may want to, from provider may want to order for the patient prior to their visit? Is there anything that within that visit that needs to be prepared? If you happen to be a practice that has a procedure embedded in their practice, is there any preparation for a particular procedure that needs to be prepared prior to the patient coming in? So preparation is a very important tool to have. It allows for readiness for the clinic daily, and also it also helps to have advanced planning so that as your charts are prepared and as your front desk is also prepared, then it would be more efficient when the patient arrives, because the practice is already prepared for their visit coming in for their scheduled date and time. The pre-visit preparation also allows for practices to mitigate when emergencies or a add-on or a walk-in potentially happens. It doesn't put so much chaos to the day, because all the other visits have already been prepared as much as possible so that they can mitigate um, unscheduled or, as I said, walk-in that occurs on occasionally. So let's go into our second topic, optimizing staff allocation. Efficient workforce management is crucial for smooth patient flow. Healthcare providers can ensure adequate coverage during busy periods by aligning staff schedules with peak patient volumes. Using data analytics to predict patient influx and adjust staffing levels accordingly, this proactive approach makes healthcare professionals feel responsible and in control of the patient flow. So, in as much as possible, when you're looking at your staffing and what is happening with the schedule, with the clinic, take a look at how many you have on busy periods. You can also look to see other options that, in terms of scheduling, perhaps you might have, a block time of just telehealth visits, for example. This would also give your staff some time to be able to perhaps reduce certain staffing allocation because you're doing telehealth appointments for that period of an hour or two, depending again on what your scheduling would look like. The other benefit to optimizing your staff allocation is cross-training employees for multiple roles. And the benefit for that is the versatility and adaptability, adding flexibility to the workforce. Well, so, for example, a nurse trained in emergency care and radiology can help alleviate bottlenecks in other department if you're in an ambulatory center. Also, this versatility allows healthcare facilities to respond quickly to changing demands and maintain efficient patient flow. So cross training is really important. In the practice, if you have an MA that can also perform front desk sometimes when it's needed, it's also important to be able to do that. If an MA can also do a referral work sometimes, that's also helpful. So cross training your practice is helpful so that in a case of short staffing, the agility and versatility to know that there's another staff member that has additional skills that can help to contribute to a smooth and efficient day, I would recommend to do cross training. It also, cross training provides insights in what other staff are doing in their role, appreciation for in another job task that they would normally not do. So, if, for example, front desk might need to be doing referral work, something that could be not unfamiliar to them, but they've also learned the importance that, oh, if I am at the front desk, all the things that I collect at the front, insurance information, accuracy in demographics, all these things are helpful because when we get to the referral pre-authorization, we need to have accurate information. So there's some relevance in the way that each job task actually has some connection. And so cross-training is helpful in that way to appreciate what another staff member is doing at another department. The third that we're going to be talking about is implementing lean methodologies. Originally developed for manufacturing, lean management techniques have found a valuable place in healthcare. These methodologies focus on eliminating waste and streamlining processes. In a healthcare setting, this might involve removing redundant paperwork, eliminating unnecessary diagnostic tests, optimizing patient pathways through the facility. So, visually designing your workflow to be able to see that patient journey. What does that look like, from patient checking in all the way to the rooming, all the way through checkout, or perhaps they need to be followed up first into the referral and pre-auth because we need to send them for testing that day. So a visual workflow is helpful to see for the staff to even take a look at that, and also gives them an idea of what are some of the things that they're doing job tasks and how it actually flows in the practice. So it's helpful to be able to see visually what your workflows look like and what that patient journey looks like. And it's also helpful sometimes to identify some gaps within that workflow that you notice, to say, oh, there might be something that we need to add in this flow that we didn't recognize that should be in this visible pathway or workflow. The other is standardizing common procedures. So lean methodologies also foster a culture of continuous improvement, empowering staff to identify inefficiencies and propose solutions. Your frontline staff who deals with patient interaction daily and with their work can also identify some efficiencies. They can also propose solutions to make their work even better, or make the flow to the practice also improve. This leads to ongoing enhancements in patient flow and makes the staff feel valued and integral to the process. It is important to involve the staff and have their input when looking at your visible workflow, for example, or your standardized procedures, because they're performing the task every day. And so there's valuable insights into what works and what is not working. So their feedback about a particular workflow, for instance, is important to gauge, what is happening that is doing well and what is not doing well, and what can we improve from that. Our last topic is leveraging technology and telehealth. Telehealth has emerged as a powerful tool for increasing patient throughput. And so since the pandemic, the use of telehealth did certainly catapult to a high surge of use. It has not dwindled down in its utilization. However, there are specialties that are utilizing telehealth that has found benefits in having a hybrid structure in the way of virtual office visits in addition to in-person office visits. So if this is something that a structure that will be helpful at your practice, something to consider in terms of how your patient schedule is designed, and also what are some of the things that would allow for a hybrid structure, for instance. It's equally essential to maintain or even enhance the telehealth appointments. Virtual consultations allow healthcare providers to manage routine follow-ups and minor health concerns without needing in-person visits. So this not only saves for both patients and providers, but also frees up physical resources for more critical cases. So what this means to me is that having to have the hybrid structure in virtual consultations and as well as inpatient consultations, you can leverage your virtual consultations for manageable routine follow-ups and minor health concerns, freeing up a bit of your schedule in the way of really needed in-person office visits. Other technological solutions that can improve patient flow include automated appointment reminders to reduce no-shows. They may come into texts to also remind patients. Most of us are tethered, if not to our cell phone. And so texting seems to have been a way to also remind the patients about their upcoming appointments. If self-check-in in kiosks to speed up the arrival process, real-time patient tracking systems to identify and address bottlenecks, mobile apps for patient communication and information sharing. So that would be your patient portal. And it does not have to be cumbersome in the way of patient portal and when receiving the messages. It's how that you're designing and integrating your staff in the way that the messages are flowing into the in-basket. And so that's something to consider, that it could be delineated to certain messages that a front desk staff can answer, or someone that would be your certified medical assistant or your nurse not necessarily a provider that can answer that question. And so something to consider. Again, it could be tied to your referral person, because it's a referral question. So it doesn't have to be the provider receiving all those messages. So in conclusion, I just want to get to consideration in terms of the throughput. So enhancing throughput is a multifaceted challenge that requires a strategic approach. You can certainly significantly improve operational efficiency by streamlining administrative processes, optimizing your staff allocation, implementing lean methodologies, and leveraging technology. So all of those key strategies, you can certainly implement that into your practice. Again, the key here is to look at your size, scope, staffing resources, digital tools, and specialty. What makes sense in all of these key points that we're talking about that could help improve efficiency in your patient throughput? So viewing these strategies as not as an isolated initiative, but part of a comprehensive approach to patient care. So when you want to implement any of these strategies effectively, you want to create a virtuous cycle of improved patient experience, better enhance operational performance. You want to have your staff input in these discussions so that everyone is involved in the change. And there are some insights that all of your staff can lend in terms of what are some of the pain points or bottlenecks or any workflows that need to be updated in order to help with patient throughput. Well, I hope all these 4 strategies will be helpful to you. And thank you for joining me at another Tuesday Tips. I look forward to seeing you all next Tuesday. Have a great day. Take care.